CNA Religious Dietary Accommodation. Welcome to the quiz. Question 1. Which of the following is an example of a complete, accurate, and objective CNA charting entry? Option A. Resident seemed very sad and depressed during AM care. She barely ate anything. Option B. Resident's blood pressure was sky high this morning. Probably forgot her meds. Option C. Resident was in a bad mood today and refused to get out of bed. Option D. 9 a.m. Resident assisted with bed bath. Skin on sacrum and heels intact, no redness. Tolerated procedure well without SB. Encouraged to drink, took 240 milliliters of orange juice. Output 300 milliliters clear yellow urine at 8:30 a.m. The answer is D. Objective charting includes specific, factual observations without opinions. Option A is incorrect because seemed sad is subjective. Option B is incorrect because sky high is subjective and probably forgot meds is an assumption. Option C is incorrect because bad mood is subjective. Option D is correct because it includes specific, factual observations without opinions or interpretations. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. A resident has an order for up-in chair with assistance for all meals. What does this order specifically require you to do? Option A. You must provide the level of help the resident needs to safely get into the chair for breakfast, lunch, and dinner every day. This is a non-negotiable part of their care plan. Option B. The resident can get up whenever they want for meals, but you must be available to help if asked. Option C. You should ask the resident each day if they want to get up for meals, as they have the right to choose. Option D. The resident must be in a chair, not in bed, for all meals, but they can get there by themselves. You only need to supervise. The answer is A. The order specifies a required intervention at each meal. Option A is correct because the order specifies with assistance and all meals, meaning it is a required intervention at each meal. Option B is incorrect because it's not optional. Option C is incorrect because the order is not optional based on the resident's daily preference. Option D is incorrect because it requires assistance, not just supervision. Question 3. The family of a resident asks you for a specific medical diagnosis and prognosis. You do not have this information in the care plan. What is the best response? Option A. Go find the resident's chart and look up the information for them so you can provide an accurate answer. Option B. I'm not authorized to give out that information. You'll need to speak with the nurse or the doctor about specific medical questions. I can let the nurse know you would like to speak with them. Option C. Tell them what you have personally observed about the resident's condition, such as their appetite and mobility, to be helpful. Option D. Give them your best guess based on your experience with other residents who have similar symptoms. The answer is B. CNAs cannot provide medical information. Referring to the nurse is appropriate. Option A is incorrect because accessing the chart without authorization is a breach of confidentiality. Option B is correct because CNAs cannot provide medical information or diagnosis. That is the nurse's or doctor's role. Option C is incorrect because sharing observations may be misinterpreted as medical advice. Option D is incorrect because guessing is unethical and could be harmful. Question 4. A resident is refusing to take a shower this morning, stating they are too tired. What is the most appropriate response that balances their rights with their hygiene needs? Option A. Tell them you understand they are tired, and you'll be back in an hour to see if they feel up to it then. Document their refusal and your plan to reapproach. If they continue to refuse, report to the nurse. Option B. Forcefully help them into the shower to maintain hygiene, explaining that it's for their own good. Option C. Give them a complete bed bath without asking, as this meets their hygiene needs without requiring them to get up. Option D. Insist that they must shower because it's on the schedule and hygiene is important for preventing infections. The answer is A. Respecting refusal while offering alternatives and involving the nurse is appropriate. Option A is correct because it respects the resident's right to refuse while offering an alternative later and involving the nurse if refusal persists. Option B is incorrect because forcing care is abuse. Option C is incorrect because providing a bed bath without consent disregards their choice. Option D is incorrect because insisting violates autonomy. Question 5. While ambulating a resident, you notice the electrical cord on their roommate's pump is frayed and damaged with visible wires. What should you do? Option A. Unplug the pump immediately to prevent electric shock, even if it means interrupting the infusion, then go find the nurse. Option B. Finish ambulating your resident safely, then immediately return to the room, unplug the pump if it's safe to do so, and report the frayed cord to the nurse so the pump can be taken out of service and tagged for repair. Option C. Ignore it as it's not your equipment and you are focused on your resident. Option D. Wrap it with electrical tape from the supply closet to make it temporarily safe and prevent anyone from getting shocked. The answer is B. Safety first. Finish your current task safely, then address the hazard. Option A is incorrect because unplugging and pump without considering the infusion could harm the resident. Reporting first allows the nurse to manage the infusion. Option B is correct because you first ensure your resident's safety, then address the hazard by reporting it so it can be properly handled. Option C is incorrect because ignoring a safety hazard is negligent. Option D is incorrect because taping is not a proper repair and could be dangerous. Question 6. When providing hair care for an African American resident, which of the following is a culturally sensitive and appropriate practice? Option A. Brushing their hair vigorously from the scalp to the ends to stimulate the scalp and distribute oils. Option B. Using a pick or wide-tooth comb, applying moisturizing products like leave-in conditioners or oils as the resident prefers, and gently detangling from the ends upward to prevent breakage and respect hair texture. Option C. Suggesting they cut their hair short to make it easier for the staff to manage and maintain. Option D. Washing their hair every day with a strong, clarifying shampoo to keep it clean. The answer is B. Respecting hair care needs specific to African American hair is culturally sensitive. Option A is incorrect because vigorous brushing can cause breakage. Option B is correct because it respects the unique needs of African American hair, which is often drier and requires moisturizing and gentle detangling. Option C is incorrect because suggesting a haircut for staff convenience is disrespectful and disregards resident preference. Option D is incorrect because daily washing with harsh shampoo can dry out hair. Great job! Don't forget to subscribe. Bye!